In Good Shape, your weekly dose of health information on Deutsche Welle. Find out more about what's new in medical treatment, alternative medicine, as well as nutrition, wellness, and beauty. Medical professionals, therapists, and counselors are in our studio to offer their expert advice on In Good Shape.
With me in the studio is Professor Malek Bajbouj. He's a psychiatrist at the Charité Hospital here in Berlin, and he's a specialist in the treatment of depression. Hello, Professor. Welcome to the show. What triggers depressions? Is it just a conflict of unresolved inner conflicts or external circumstances, or is it just in our genes?
What we know nowadays is that's a combination of our genes. So we come to Earth with a certain likelihood to get a depression or not. And that in combination with events in early lifehood leads to a depression or not.
Okay, and who's especially at risk for developing depression over a lifetime?
What is known nowadays is that the early lifehood is very, very important. So if you do have adverse events there, traumatic experiences, this increases your risk for depression. And from a personality side, it's those people who are very faithful, over-careful. These are the people who are at risk for depression.
And this is true worldwide, or are there any cultural differences over the globe?
It is known that there are cultural differences how depression looks like. With respect to the likelihood to get a depression, it is worldwide the same phenomenon, but how depression looks like is different, but it is finally the same disease worldwide.
But suffering from depression is not just being in a bad mood. So how do you actually diagnose depression as a psychiatrist?
Depression is something which is, as you correctly stated, more than bad mood. It is if you suffer every day for at least 14 days, bad mood, loss of interest, sleep disturbances, loss of appetite, then one might diagnose a depression.
And those are the warning signs, so the patient can say by themselves, I'm depressed.
It is individually very different what the warning signs are. So some patients tell us it's the sleep, others say it's the appetite, loss of interest, but these are the key features of a depression, yes.
And sometimes the patients don't even recognize that they are depressed, but friends maybe might recognize this. We got a viewer question from Aslan Popov from Russia, and he wants to know, he's got a friend and he thinks he's depressed, the friend is depressed, but the friend doesn't want to go to see a doctor. What can Mr. Popov do?
So the stigmatization of depression is still something which is worldwide present. So usually it is very, very useful to take symptoms out of depression which are accepted, such as sleep disturbances or somatic syndromes, and go with these symptoms to a doctor.
Okay, and who's the right doctor to go to? Is it a psychiatrist or is it just a normal GP family doctor?
That's very different worldwide. So in Germany, it would be a psychiatrist. In regions where psychiatrists are not so often present, it would be the general practitioner.
Mm-hmm. And the World Health Organization estimates that 350 million people worldwide suffer from depression. Are the numbers going up, or is just the diagnosis getting better?
The numbers are going up because the diagnoses are getting better. So diagnosis is made more frequent, more often, with increasing knowledge about depression worldwide.
Mm-hmm. And what about depression in childhood or in adolescence? Are they going up as well?
The same phenomenon. So it is known that how depression looks different than in adults, and that's the reason why it's going up.
Dr. Bajbouj, we just saw you in the report performing ECT or electroconvulsive therapy, and I must say, quite impressive. But is this method not dangerous for dying brain cells?
That is what is usually assumed, that neurons, brain cells are dying. But it is known that exactly the opposite happens. So neurons, new cells are born, are newly developed by this treatment. So it is something which is completely opposite of what one would expect in depressive patients.
So it's more protective to the brain. Okay. And is it effective?
It is extremely effective. So mainly 80% of every patient treated with that treatment responds. So it is a quite high number of patients who respond to that very good treatment.
And do you think this could be mainstream medicine one day?
One needs to perform a lot of effort. So 2 doctors involved, two nursing staff. So I would therefore not assume that that will be mainstream. But for those patients where psychotherapy does not work, where medication does not have effects, for those patients, ECT is a wonderful alternative.
And as a psychiatrist, you're not using electroconvulsive therapy, you're doing research on using ketamine, which is a general anesthetic drug. How is this performed? How is that working?
That's a quite new development in antidepressant treatment. So what we have observed there is that ketamine works quite fast. So patients come out of the depression within hours, within 24 hours, which is unknown and very, very new to us and an exciting new research field.
Okay. And the dangers of that method, of the ketamine method?
So it is in anesthesia, it's quite safe method. We have to select the right patients, or patient without hypertonia, or without any heart diseases. But for those patients, it's a safe treatment. What happens from time to time is that patients get delusions which are not wished. But if we select the right patients, it's a quite safe method.
Okay. For me as a GP, I'm not using electroconvulsive therapy. I'm not using ketamine. I'm using drugs, actually. So what kind of patients are in the need of drugs or just lifestyle changes? When do I have to prescribe pharmaceutical treatment?
There are guidelines which say that the first-line treatment in moderate depression is an antidepressant. These are the patient for the drugs and the main pillar of the treatment. If patients have a less severe depression, one might discuss whether psychotherapy should be used or medication. But that's something which we usually discuss together with the patient and prescribe that or perform that which the patient wishes.
Okay, but and what about lifestyle changes? We got a lot of viewer questions, especially from Pakistan, with patients who want to know if sports can help in depression.
Yeah. In depression, which are not so severe, sport might be an effective treatment. So there's research going on at Charité, for example, which shows and indicates that in moderate depression, depression of less severity, sport can be as effective as a psychotherapy.
As effective as psychotherapy. That's promising. And what about prevention of depression? Are there any methods that I can prevent going into this mood?
Well, we nowadays live in a world with a number of difficulties, which makes it more likely to get a depression. So if you stand back from time to time and if you stop being over careful, that might be a good way to prevent depression.
Great. Dr. Bajbouj, thank you so much for being in the studio with us.
Thank you.
Thank you.